Can someone have fibroid and still be pregnant? In that case, what happens to the pregnancy or the fibroid? Will the fibroid be able to take the pregnancy to term? Or will the baby abort? Will the fibroid shrink? All these questions, I'm going to answer it in this video. But before then, we'll take a quick look at what fibroid is, its signs and symptoms, and what are the possible treatments of fibroid. If this is a topic you are interested in, I will urge you to watch this video to the very end, and I know you will learn something. If today is your first time of coming across my video, I'm Naki the midwife. I'm a professional midwife and I talk about issues on pregnancy, babies, delivery, family planning, and anything pertaining to ladies' health. Welcome to today's video. Fibroid is a non-cancerous growth that develops in the womb of a woman. Okay, that is what fibroid is. And then about 20 to 40% of women of childbearing age will definitely be able to experience this one way or the other in their life. One funny thing about fibroid is that you really don't see the signs and symptoms. You don't even know you have it until you get to your childbearing age, where either the baby is not coming or you are finding it difficult to have kids and all that. When you go for scan and labs, that is when it is identified. Okay, but in this video, we'll learn something very brief about it. Now, the actual cause of fibroid is not known. Scientists have not come across the exact cause of this fibroid. However, research shows that the female hormone known as estrogen is able to promote the growth of this fibroid. Let's get this clear. The exact cause is not known, but the female hormone, which is estrogen, promotes the growth of this fibroid. That is not the hormone that is causing it, no, it just promotes its growth. Okay, so that is fibroid for you. Like I said earlier, the signs and symptoms are not known, so it's mostly when you get to your childbearing age that you get to know that you are having fibroid or not. So signs and symptoms like you bleeding a lot when you're having your menses, heavy bleeding when you're having your menses, and even sometimes in between periods, okay, it's a clear sign or it's one of the signs of fibroid. So bleeding in between periods simply means you having your period and before your next period, you are having another period again. That is bleeding in between period, and it can be a sign of fibroid. We have ectopic pregnancy. The reason being that this fibroid has gone to occupy space in your womb. Hence, the fertilized egg is not able to go there to go and implant. It doesn't have any space. So, the only place it has is your fallopian tube. Hence, you having ectopic pregnancy. Miscarriage is another sign of fibroid. Now, why does the miscarriage happen? The baby and the fibroid are competing for space. During pregnancy, the hormone estrogen increases. Remember I said earlier that it promotes the growth of this fibroid. Yes, so now that the baby is growing, the fibroid will also be growing because now there's a lot of hormone supply to both the baby and then the fibroid. But one has to give space for the other, and it's going to be the baby, leading to miscarriage or abortion. That is one other sign of fibroid. Have severe backache as a sign of fibroid. This is because the fibroid is going to be pressing on some nerves at your back, leading you to have severe back pain. So if you are someone who does have severe back pain every now and then, you should go to the hospital to check to know if it's fibroid or not. It's just one of the signs that you experience as well. Bleeding after delivery is one other sign of fibroid. Okay, this is because your womb is not able to contract well after you deliver, leading you to bleed a lot after you've delivered. Okay, so this is another sign of fibroid. How is fibroid detected or how is it diagnosed? Mostly when you go for maybe scan or some test or some lab, that is when they come across the fact that you have fibroid. So you get to know when you have a scan, okay, or you are experiencing some of the signs and symptoms I just mentioned. Then if it's confirmed, then you know that you have fibroid. What are the treatment plan for fibroid? The treatment plan is mostly categorized into two parts, which is surgical part and then non-surgical part, whether you have surgery or not, okay? And then all this is determined by whether the fibroid is so big or your age, whether you have any plans of having babies. That's what determines whether we'll give you the surgical plan or the non-surgical plan. Now let's take them one after the other. With the non-surgical plan, we have two things that we do, which is observation. Then the second thing we do under the non-surgical procedure is the gonadotrophin-releasing hormone agonist. I know it's a big term, I will explain all. About the observation, this one, if we've detected that the fibroid is very small, then we just observe it, okay, to see whether it will grow or not. If it's not growing, you're not having any pain, you're not experiencing any of the signs and symptoms I just mentioned, we just leave it there and observe it. And also, in case you are in your menopause and then you have fibroid, okay, that one, it will go on its own, because when you get to menopause, the hormone estrogen reduces. That brings me to the video I made on menopause. If you haven't watched that, please go and watch it, okay? I spoke about what menopause is, all you need to know about menopause, okay? So if you are getting to menopause, we will just leave it because it will just shrink on its own. Now, the gonadotrophin-releasing hormone agonist. With this one, it's just an injection we give, okay, so that the hormone, which is estrogen, the production of it will reduce, because we said that it is what fuels the growth of this fibroid. So when the production is reduced, the fibroid will automatically also reduce. So this one is just an injection we give either monthly or every 3 months, and it can be taken just within 6 months, okay? After 6 months, you are not supposed to take this. You are not supposed to take this injection. And it's mostly done when we want to reduce the size of the fibroid before we do surgery for you, okay? So that is about the non-surgical plans we have for fibroid. About the surgical plans for fibroid, there are 3 things that is done. Myomectomy, which is removing the fibroid and leaving your womb intact. You are just removing just the fibroid, okay? And you can go ahead to have kids, as many as you want, okay? When the fibroid is removed, you are good to go, okay? That's the first one. And the second one is what we call hysterectomy. With this one, if the fibroid becomes too big, okay, and then you are experiencing a whole lot of signs and symptoms, is interrupting your daily activities, you literally can't do anything because of this fibroid, we just have one option: to remove the fibroid together with your womb. Yes, what this means is that once the womb is removed, you won't be able to have kids again. Okay, so in this particular, there are a whole lot of things that are considered, whether the person has plans of delivering again, okay, whether the person is old, whether the person is young. It depends on a whole lot of factors, and then the size of the fibroid. So we consider all these things, then we go for hysterectomy, which is removing your womb together with the fibroid. Okay, so that's the second one. Then the very last surgical procedure we do is what we call uterine artery embolization. With this particular procedure, what is done is that they locate the blood vessel that is sending blood to the fibroid, and then they just occlude it, or they stop it or prevent it from sending blood to the fibroid. And it's just a matter of time, then the fibroid will just shrink on its own. That is the very last procedure that is done for fibroid. Back to the question that I spoke about earlier. Okay, can someone have fibroid and still be pregnant? Of course, yes. The answer is a big yes. You can have fibroid and you can get pregnant at the same time. Okay, now what happens in this case is that once the fibroid is growing, your baby is also growing, because the production of the hormone estrogen is increased during pregnancy. So it's fueling the growth of both your baby and then the fibroid, okay? But in some cases, you can get a miscarriage because the baby has to give space for the fibroid if the fibroid is becoming too big, okay? In another case too, both the baby and the fibroid can grow together. Your baby can be delivered and the fibroid will be taken after you deliver. Yes, so that is the 2 things that can happen when someone gets pregnant and still gets fibroid. Either your baby is delivered or you get a miscarriage along the way because of the fibroid. But the fibroid does not shrink whilst you are pregnant. Know this. We've come to the end of this video. If this video has been helpful enough, please give it a thumbs up, subscribe, share, and then let us know what you want us to talk about in our next video. See you in my next video. Bye for now.